Employee benefits at Harbor Care. Compensation, you will receive approximately $21 per hour. Flex Card, $2 of the hourly rate can be received tax-free through the Flex Card, which can provide benefits such as reduced income taxes and continued eligibility for Medicaid. Paid time off, PTO, approximately $2 of the hourly rate accrues as PTO, which can be converted into cash if unused. Aid Referral Program, refer a HHA, PCA, and after their first day of work, you will receive a $100 referral bonus. Daily pay, you can receive payment on the same day you work using the Keeper app. 401k, we offer a 401k retirement savings plan. For more information about these benefits, please contact Harbor Care's Human Resources. How to reach Harbor Care. Phone, 718-743-2432. For other languages, option 1. Intake Department, option 2. Nursing Department, option 5. Human Resources, option 3. Administrative Department, option 6. Coordination Department, option 4. Payroll Department, option 7. To reach Harbor Care after regular working hours, call 718-743-2432 and press option 5 for English. Upon arrival at patient's home. 1. Clock in using the patient's phone or your mobile app. 2. Ensure proper hand hygiene by washing hands with soap and water for a minimum of 20 seconds, including nails and wrists, to maintain cleanliness and prevent infection transmission. 3. Reserve hand sanitizer as a backup option. Always prioritize using soap and water. 4. Use paper towels for drying hands instead of the patient's towels to minimize the risk of spreading bacteria. In the event of a fall. 1. Immediately call 911 to ensure prompt medical attention for the patient. 2. Refrain from touching or repositioning the patient, as it may worsen any potential injuries. 3. If the patient does not want you to call 911, explain that it is necessary for their safety and it is agency policy. If they persist, inform them that they can refuse to go to the emergency room once 911 arrives. If resistance continues, call 911 and contact Harbor Care for further assistance. After calling 911 for a fall. 1. Notify the agency or coordinator immediately, utilizing our 24-hour on-call support. Delaying notification until the next morning may result in disciplinary action. 2. Inform the patient's family or emergency contact about the situation to keep them informed and involved, if applicable. If EMS arrives near the end of your shift. 1. Stay with the patient and make alternative arrangements, such as arranging childcare or informing relevant parties, to avoid leaving the patient alone, which can be considered patient abandonment and may lead to termination. 2. Accompany the patient to the emergency room unless family members are present to accompany them. If no family is present, it's important to go to the emergency room with the patient. 3. If the patient is discharged after receiving treatment, accompany them back home and clock out at their residence. You will be paid for any extra time. 4. If the patient is admitted to the nursing unit, clock out from the hospital and return home. Seek permission from a nurse to use the hospital's phone for clocking out. 5. If the family arrives at the emergency room, leave and remember to clock out of the hospital. Regarding medication handling. 1. Permitted actions include going to the pharmacy, reminding the patient to take medications, ensuring medications are within their reach, providing water, applying creams, lotions, and moisturizers, and opening medication pill boxes, pending confirmation. 2. Not permitted actions include touching pills directly, even with gloves, inserting pills into the patient's mouth, pre-pouring medication, crushing medication into powder, or administering any form of injection. Timekeeping and attendance. 1. Use the mobile app or the patient's phone to clock in and out. Timesheets are only accepted in case of system failures or emergencies. 2. To submit a timesheet, fax it to 718-743-2398 or email it to timesheets@harborcareany.com. Ensure the photo is clear and the entire page is visible. Confirm receipt with your coordinator. 3. Avoid overlapping schedules with another agency. Conflicts will result in disciplinary action and possible termination. 4. Leaving your shift early without notifying HarborCare is considered patient abandonment and will lead to termination. 5. Leaving your shift late does not entitle you to extra pay unless prior approval is granted by HarborCare, or in the situation of a hospitalization, see above. Vacation and sick/personal days. 1. Notify your coordinator 1 month in advance to request vacation time. This ensures sufficient time to arrange a replacement. 2. If you need to take a sick or personal day, inform your coordinator at least 3 hours in advance. Criminal background and fingerprinting. 1. All new aides undergo a mandatory criminal background check before their first shift. HR will provide instructions for obtaining fingerprints, including appointment details and payment information. 2. Rescheduling is possible with a valid excuse, but fingerprinting is a legal requirement that cannot be avoided. You are allowed just one rescheduling. 3. HarborCare will cover the cost of the fingerprinting. Final takeaways. Follow the plan of care in the patient's home. Always wear your uniform and have HarborCare ID. Be punctual. Lateness will not be tolerated. Clock in and out using the patient's phone or mobile app. Avoid last-minute call-outs or calling on Friday for the next week. Work the full shift as scheduled, neither more nor less. Do not use your cell phone while on the patient's time. Keep patient's information, directions, and schedule with you. Report any bruises, cuts, scabs, etc. immediately. Confirm patient's doctor appointments with HarborCare. Do not accept any gifts, money, or house keys from the patient or their family. Do not abandon your patient for any reason. Call the office if you're running late, regardless of the reason. Ensure patient safety before running errands or doing laundry. In case of an emergency, call 911 first, then contact HarborCare and ask them to inform the patient's family. If the patient is admitted to the hospital, leave the premises. Avoid discussing your personal life with the patient. Schedule time off in advance, 2 weeks prior for vacation, 4 weeks prior for holidays. Inform HR of any changes in your contact number or address. Avoid wearing perfumes or strong scents. Qualities of a great aide. 1. Punctuality, arrive and leave on time, meeting patients' expectations and providing services according to their schedule. 2. Consistency, maintain regular attendance to establish familiarity and trust with patients who prefer consistent caregivers. 3. Caring, treat each patient with compassion and empathy, as if they were your own family member, taking pride in the responsibility of assisting and caring for others. 4. Communication, engage in open communication with patients to ensure their needs are met and maintain regular communication with the agency, to address both your and the patient's requirements. Constant communication is key for providing quality care.